So, our next speakers, we have not one, but two people on stage for you next. One, a chiropractor, Dr. Stefaan Vossen, who I was at college with him. He comes from one of the largest sort of clinical families in Europe. Loads of doctors, chiropractors, clinicians of every kind. And he now runs a big polyclinic, chiropractic-led polyclinic in the Midlands, seeing loads of patients, athletes, all sorts of stuff. And the other, a man with an amazing story, from the Paras to the Paralympics with world championships in between. His name is Jaco van Gass. So, ladies and gentlemen, let's give it up. A massive UCA welcome for Stefaan and Jaco!
Good, yeah, that's working. Good morning, everybody. Lovely to be here. I'm going to start off with an admission. I am a complete imposter here, and I'm here just basking in the glory of having been able to work with an amazing guy like Jaco. And it does get emotional for me at times, because it is in these moments that I actually really end up realizing why I do what I do, and why I made all the choices, difficult choices, that I have made, and I find myself here today with him on the stage. The second thing I want to say is that I swear a lot, and it's usually limited to shit, fuck, bollocks, but it doesn't go beyond that, and I hate to offend, and I don't mean to offend. It's not a facile usage, it's just stylistic. The third thing is I go off on tangents a lot. And I'm going to put a timer on just to manage that. I enjoy them. I hope you enjoy them too. But more importantly than anything else, I'm really pleased to be here and share the stage with Jaco so that he can tell you a bit about his story and our story as well. Before I introduce Jaco, I'm going to just tell you a little bit about myself. I'm going to refer to my notes because I have people that make notes for me so that I stay on track and don't go over. There we go, start. Now, the biggest thing that I wanted to touch on, and Neil very kindly mentioned this already, I do come from a big family, a big chiropractic family, a big sports-led chiropractic family, and I was born into a luxury that some of you or most of you might not have, and that is the fact that I was given the confidence to act in this space and to demand the right to act in this space. And if anything, I would like you to all take that away from here. We have the right to act in this space, and we can do amazing things. Thank you. So we'll go into just a quick, is this the slide bit? There we go. Quick housekeeping. Basically, I'm just going to introduce our talk. We'll then have a bit of question time, hopefully. And then after that, you have the break, and there is the award straight after? Ross. Sorry, Ross straight after, amazing. And then a break, sorry. The real story here is of our collaboration, Jaco and mine. And I myself, so my name is Stefaan Vossen, I'm a 2003 ACC graduate. Like Neil said, I was born into a healthcare tribe, as Donald was mentioning earlier. And that does give you a lot of luxuries and a lot of insights. And none of that should mean that I'm advantaged, none of that should mean that you're disadvantaged, and I just want to share that with you. I do run a large polyclinic. It's a chiropractor-led polyclinic, multidisciplinary clinic. I employ, which is also quite unusual for a lot of our clinic operators, friends out there. And we have everything from osteopaths, GPs, physios, massage therapists, psychologists, etc. And the idea is that we get together to form an alliance around our patients' needs. And from that, we have managed to build a very successful clinic, and I'm hoping to inspire, if nothing else, what is going to be possible in that space in the near future. Jaco, I'm going to hand over to in a second. He's going to say a lot of lovely things about me and our work together. And I made sure of that. I've told him 1,000 times what to say. And I am going to be very, very pleased to hear him talk about what we're going to be doing, what we have been doing together on the way to Tokyo. But there's been a long road before that. In fact, just on the way up here, I had to be reminded that it was 2014, not 2015, when we started to work together. So this is not something that happened over the past month. This is not something that happened in an IA and 2 appointments afterwards. This has been a long and significant road in which that there have been a lot of needs to deliver ideas, insights. We had to figure out solutions to problems we didn't even know existed, and we had to think very much a whole deal laterally. Earlier on in the previous speakers, there was mention around outcomes, and there was talk about the heart of chiropractic, and there is about this division. I will touch on that too, because I think it's really important. I'm very outcome-led, and that is because I understand or I appreciate that for our patients, whether they are an endurance athlete or whether they're a performance athlete, or whether this is Mrs. Smith wanting to go down to garden, as was mentioned in the earlier talk. To me, all of these things are outcomes, but above all, they generate a huge interest in what we do as professionals. And it's on that basis that I wanted to share with you my experiences with Jaco, so that we can all share that across our professional field. So on that note, I'm going to hand over to Jaco. I would like to give you this. I'm not sure, there are some active bits in there. So AV man, we've got some buttons to press.
Exactly. Thank you, Stefan. I faced many challenges in my life, to be very honest. But when I was given this task to tell my life story within a really confined space of time, it's one of the ones I might struggle with, because we've done so much. But I'm going to give it a good go and a good try. My name is Jaco van Gass, and I had the privilege and the honor to serve within the British military with the parachute regiment. And it was on my second tour of duty to Afghanistan when I sustained life-changing injuries. I had a mere 2 weeks left before returning home. We deployed on what was probably one of our final missions. A very successful operation, and heading back into the desert to where the helicopters were going to pick us up. We operate mostly in the cover of darkness. We came across a Taliban stronghold, and about 45 minutes into what was a severe firefight, I was hit by an RPG, a rocket-propelled grenade. And that very moment, my life changed forever. I was very fortunate enough that my teammates around me knew what to do with first aid. We very soon got medical treatment in from a medic. And it's once we established a safe surrounding that the helicopters could come in, pick me up, and fly me back to safety. And it's once on that helicopter that I knew I was going home. Dead or alive, I was going home. It's at that point that I lost consciousness. And 6 days later, I woke up out of an induced coma. Now, usually I say the next slide is quite graphic, so do look away, but I'm sure you guys seen much worse. So 6 days later, I woke up out of an induced coma. Seeing friends and family faces around me was very confusing, because my last clear memory was being in Afghanistan in a firefight. And I knew I got injured, and I thought I was in a hospital in Kabul or Bastion somewhere, and my family is in Afghanistan. I didn't want them there. It's not a safe place to be. But with a lot of convincing from the doctors and my family, they said, Jaco, you're in Birmingham, you're in Silk Hospital, it's all fine. And I thought, great, from Afghanistan to Birmingham, from one shithole to another. But I'm joking. It's a lovely place. I really do. But this was the first time I can really reflect on what happened to me. I remember that night losing my arm. I remember the rocket hitting me, looking down, and my arm was gone. But what I didn't know was the extent of my injuries that I sustained. I've lost my left arm just above the elbow. I had a collapsed left lung. I had shrapnel wounds to my left side, which punctured some of my internal organs, which led to having a colostomy for about 9 months. I've lost a third of muscle and tissue to my left upper thigh, a fractured knee, fasciotomy on both sides of my left calf, broken tibia and fibia, just to name some of the ones I can remember. So it's looking down on myself that I realized my military career is over. And if I couldn't be in the military and do the one thing that I loved so much and the job that I was really good at, what will I be able to do? Where am I going to go? Who's going to employ someone with half an arm missing and a leg? And I actually fell into quite a bit of a depression, thinking the future is going to be quite dark and bleak. It's during my time in my hospital bed, I was watching a program about an Australian lady. She was severely disabled, but during the program she mentioned something, and it was this, that life is 10% what happens to you, and 90% how you respond to it. And I thought that was so powerful. And I've applied that to my life ever since. Learning to walk again, learning to run again, constantly setting myself new goals and new challenges. And one day, the biggest challenge of them all came my way, to be part of a team to walk unsupported to the geographical North Pole. There should be a video.
I got shot 2.5 years ago. The bullet severed my artery. This will be the single biggest test that I've probably ever had. The biggest challenge I'm going to face with one hand is getting that tent up quickly so it's not going to get blown away in the wind.
Being injured last year in Afghanistan, I've got hit by an RPG while we were on patrol. Got into contact, and yes, got hit from the flank by an RPG.
In Afghanistan, during Panther's Claw, I got struck by an IED, and obviously that's when I broke my back. That was a awful day. I was told, you know, you're not going to walk again.
My vehicle was hit by an RPG, which pierced the hull of the vehicle, went through my leg.
I'm missing an ankle and a calf, and it is really not that big a deal. And for me, it is not holding me back, and it won't hold me back.
You can carry on. If you put your mind to it, really there's nothing that can stop you. This means really a lot to me.
Something I've always wanted to do, like, this is probably the biggest challenge out there.
My youngest son is severely disabled, and these guys have come into disability, and I feel quite close to trying to raise money for people who have disabilities. I mean, you know, whether they've been blown up in war, whether they're born with them.
A huge proportion of the wounded who have come back from Iraq and Afghanistan, they couldn't do this, but they've still got the potential of a full and active life, and hopefully by these guys achieving what we aim to achieve, that will provide some inspiration for these other people.
Never quit. Never.
So out of 110 applicants, only 4 of us was chosen to take on this amazing challenge. And we found ourselves in a lot of very cold environments, training, preparing for this, and very soon before we knew it, we were on the polar ice cap, ready to take on this great challenge. And we'll be facing a number of smaller challenges along the way. Polar bears, we had to have a really good lookout for them. We take on these expeditions in the spring. These guys come out of a very long winter, having had very little to eat, actively looking for food. Imagine a couple of people with arms missing and limbs missing. A polar bear, I think it's Christmas already. The thin ice, obviously the North Pole is purely made out of frozen sea ice, so the conditions of the ice, and then obviously the cold and a number of other factors. But after 2 weeks of constantly of pulling sledges, anything between 10 and 15 hours a day, looking out for polar bears, for ice, rubber fields, we made it. We stood on top of the world at 90 degrees north. And this was truly a remarkable moment for all of us, because so many people said we can't do it, we won't be able to do it, the injuries we sustained and we're carrying is too severe, the distance we wanted to do unsupported was too long. So proving them wrong was amazing, but also for ourselves, the belief in ourselves. And this is literally almost a caveat point where I went, wow, if I just did this and I just achieved this, I really can go on to do a lot more. Back in London, the question on everyone's lips was, what's next? Caught us a bit by surprise, but we came up with the next challenge, to put a wounded soldier on top of the world once more, and that was Everest. 8,856 meters above sea level. We selected another team. I was very fortunate to be part of that team again. And we found ourselves in the Himalayas at base camp, ready to take on, again, a humongous challenge. And this really takes time, because we had to go through a full acclimatization phase before you get to the summit of Everest. And eventually our weather window opened, we were acclimatized, and we set off through to Camp 2, spent a few days there. We made numerous attempts to Camp 3, didn't quite get there. We had to turn around a few times due to extreme weather conditions. After another couple of days in Camp 2, a decision was made to go all the way back to base camp, where it's a lot more comfortable for us. And we're going to wait it out. We're going to wait out a few more days or weeks for a second window. And while at base camp, our expedition leader, Russell Bryce, called us in and said, we're done. It's too dangerous. The weather is not playing ball. The mountain is extremely dangerous. The Sherpas had a feeling of, they weren't comfy. Our expedition is cancelled. And this is a real big shock to the system, real big disappointment. At this point, we were 10 weeks, 11 weeks away from our friends and our loved ones. We have to come back and face them and say, oh, we didn't make it, we failed. Whilst at base camp, packing up, getting ready to move low down the mountain, I was having a conversation with a friend on text, and he sent me a verse, reading this, saying, success is not final, failure is not final, but it's the courage to continue that counts. And that moment it hit me that, you know what, I don't think we failed. The pure fact that we even attempted something so extraordinary, so out there, to even with the injuries sustained, myself and the rest of the team, to even try to summit Everest, that in itself is mission success. If we go back to that picture of me in my hospital bed, wondering where my life's going to go, what the future's going to look like, to then look back and go, well, I've learned to run again, run a number of marathons, walk to the North Pole, X, Y, Z, and then even attempting this. It's definitely mission success. Again, heading back home, we were recovered, and it was time for the Olympic and Paralympic Games in London. I was very fortunate to be part of such a huge event in a small way. I was a torchbearer through the streets of London, literally in the final phases before the Games started. I also had the experience of sitting in the crowd, cheering and watching these guys on, and by doing that, something inside me was like, I don't want to sit in these seats. I want to be there on the field of play and wanting these people to cheer me on. And that's where my journey started. And I think, gosh, I then started that journey to becoming a Paralympian. And cycling was always a passion of mine. I always had an interest into that. And that's where I bumped into Stefaan during my build-up towards Rio. I had a really bad accident. I broke my scapula, and we were introduced through some mutual friends. And immediately I started seeing some of the benefits of seeing Stefaan and the practices that he did on me. We move on quite a big chunk, quickly onto 2016. And yeah, I was within a couple of months out from getting selected for Rio, and sadly it wasn't to be. I wasn't on a plane. There was 5 places available. We were 12 athletes to very high standards, all that can go and win a medal, and I was not selected to be one of those 5 athletes to go to Rio. Again, dealing with this disappointment was very tough and very hard. For 4 years, I moved to Manchester. I left no stone unturned. The work we've done was immense. We looked into so many different avenues of how I can be better. But I took a bit of a few steps back and I said, right, I was following the kind of recycling pathway and program, and I decided that, you know what, there's elements of that doesn't fit me. It doesn't suit me as an individual. And I made a very, very difficult decision to actually step back from the program, removing myself from the program, to then take on the challenge of trying to get myself to Tokyo as an independent rider. And again, I've opened up this conversation with Stefaan, and he was more happier than ever to help me through that. And I started building this team, and him being a core part, probably one of the pillars within my team around me of how I'm going to do this, how's this pathway going to look like to get to the next stage. And then we fast forward another couple of years, and we went on to the World Championships in 2020, just before the Tokyo Games, and I became a 3-time world champion and 2-time silver medalist. So with this new World Championship title, British Cycling came to me and said, listen, your chances of going to Tokyo looks really, really good. Do you want to come back on a team to go and represent Great Britain? And so we did. But then, as we all know, this little pandemic occurred, and everything came to a halt. And before we knew it, I had 2 months out from where we were doing a great deal of work and got me into the best shape I've been in a long, long time, to suddenly, we've got 18 months now. So again, we had to work backwards from, okay, well, how do we maintain, from the work I do with Stefaan, from the work that I do myself, to my training, to everything. And we just looked into every single possibility of, right, we've got 18 months, what can we do better? In cycling, you would have heard this term so many times, that marginal gains. Where do we get myself quicker? How do I go faster on a bike? And we looked at a lot of stuff, from my position on a bike to my recovery, to everything else, to prosthetics. But the first person I approached was Stefaan. I said, we've got a bit more time. But before I could, obviously, we were all in lockdown. And my mum always said that you never know something, you never know how good it is until you don't have it. And this was the first time I really, really, really realized the amazing work Stefaan does. Because during that lockdown period, not being able to see him, my body started going back to where it was, back to all the old habits. And I've never been so uncomfortable on a bike in my life. I've never had so much pain that I endured on a daily basis. As those corrections, I'm speaking your term, I don't even know what I'm speaking about. Adjustments, that's the right word. As that adjustments was unadjusting, my body was in absolute chaos. And I remember myself and my partner buying stuff off we were doing cupping, we were doing anything just to keep me on a bike. I had to lower my saddle on my bike, I had to adjust my whole setup that I've ridden for so many years just to accommodate myself so I can keep training. And that's when I really, really, really realized the amazing work and just the effort that Stefaan's put in and how much I utilize that. And we've seen that in power outputs, performances and everything. I know I've seen it from day one, but like I say, you almost get so used to it. And then when I didn't have it, it was unbelievable. 18 months on the line, we're in Tokyo. We don't have the crowds, we don't have the people cheering me on, but we managed to get there. And again, it was truly a bit of a fairy tale story. And like I say, this was 8 years down the line. This was a dream from sitting in the crowds in London to, like I say, nearly 8-9 years down the line, to then becoming a double Paralympic champion, a 3-time world record holder, which is just, in my eyes, it's unbelievable. I can't even ever, my dream was always becoming a Paralympian, yet alone a Paralympic champion. So I would never have been able to do that with the team around me, and especially with the team from Stefaan. So thank you so much.
Thank you, Jaco. I told you they'd say nice things, even if it doesn't know what a subluxation or an adjustment is. But the point is, he knows what it does, and he knows what it means, and that's all that matters to me, essentially, and that's where I'm coming from. So there are a couple of things that I wanted to share with you. Obviously, this is not your standard clinical presentation. There is scar tissue, there is shrapnel, there is an incredible physiological stress, there is the possibility of PTSD that needs to be investigated. We need to look at psychological factors and cofactors. We needed to look at nutrition. We needed to look at a lot of things. And I'm lazy, right? So I surround myself with a whole bunch of people that are really good at that stuff. And lo and behold, you have a multidisciplinary team. That's what that is. And because I don't like doing things with my hands, I get other people to do stuff with machines. And that's where multimodal care comes in. There is no conflict. And again, forgive me the improvisation and the tangent, but there seems to be a narrative that we're entertaining of conflict between pain and wellness care. There isn't. 99% of the patients that you're going to see are going to come in with a need, a disability, a pain, or an inconvenience of some sort. They're motivated by that thing. That's the beginning of that spectrum. And then it crosses all the way over to teaching them healthy habits, things that they can do to keep themselves out of our offices. And that's really key, because if you make space in that way by enabling people, by educating people, by giving them information and access to care that keeps them out of your office, you are inviting them into wellness. And that's really what I think I wanted to do when I realized I wanted to become a chiropractor when I was 14 years age. And there are a couple of things that I want to share with you, obviously, around the clinical presentation, the difficulties that we had, the challenges that we had, and I'm just going to flick through the slides and hopefully make some sense to you all. I'll happily take any questions later on. So the first thing is that I wanted to just explain to you the whole issue around scar tissue and shrapnel. I'm not going to assume that many of you have worked with people that have significant amounts of scar tissue, let alone shrapnel, but scar tissue is a really important type of tissue that can really cause a lot of distortions, can cause a lot of issues. And we had to address those, and we had to address those fast, because it was creating all sorts of issues. Now, the biggest thing was, let me just try and grab, where did I touch on this? Because next thing you know, I'm going to completely ad-lib, and then you'll be all buggered. Now, there we go, that's why. So the first thing was around the scar tissue. The next thing was understanding how the scar tissue was playing a role in this whole neurobiomechanical understanding of how Jaco sits on a bike, pedals. Now, there are a lot of really important things to realize here. One is standing, walking is different to lying down, is different to cycling, is different, to running. All of these different behaviors have different requirements and different neurological plans attached to them, training plans. And we had to understand how these presentations that Jaco came in with were going to be, how I was going to be able to influence them and change them. And the reality was that it created a lot of very significant problems. Jaco didn't know about any of this because I was sweating it out behind his back. And trust me, there were a lot of moments where I was sweating it out. The third thing that I needed to broach was actually what kind of clinical strategy was I going to be using? Was I going to be thinking about injuries? Was I going to be thinking about scar tissue, where it was? Or was I actually going to be thinking about how the impact of those issues was on a global scale? And the difference between those two is incredibly important. There is space for both in our practices. Sometimes a patient will just sprain an ankle. It's just a sprained ankle. Like Freud says, sometimes it's just a cigar. For those who don't know, it's because there was an implication that they had something to do with oral sex. Now, the last thing, sorry, not the last thing, the one but last thing, was the psychological cofactors. Now, you'll all appreciate that if you are in an incident that you cannot control the environment of, whether that is a car accident, or whether that is an attack, or whether that is sustaining injuries like the injuries that Jaco sustained, there is a very serious possibility of that altering your psychology, your outlook on everything, the way that you're going to build your habits, let alone train. There are places that you go to in your mind when you sustain things like that. There are places that you can access that enable you to do things that normal people cannot do. And that needs to be understood by the clinician that is supporting somebody like that. There's also the possibility that actually this was potentially going to harm Jaco. And I needed to understand him very well in order to do that. Turns out he's just an incredible guy. Like proper incredible. He's one of these guys that the more stress you pile onto him, the calmer he gets. Right? And that is something that you need to understand. Those people find themselves in those situations. They start calming down and they just help everyone else. If I'm not mistaken, when you were shot, you didn't even know that you were missing an arm. It was only when Jaco was trying to hold his gun, his machine gun. Sorry, if I'm not machine gun, what do you call it? Rifle, sorry. That's how much I know. When he was trying to bring up his rifle, that you realized he didn't have an arm. This is real stuff, and it needs to all be considered. That then brought me into physiological behaviors. In terms of the training, what was it going to mean to be training that kind of mileage, on that kind of terrain, under the circumstances? We then looked, as Tokyo became more and more real, we started looking at what's the weather like in Tokyo in the summer. We had to figure out that it was very humid and very hot. That was pleasant. I got sent some WhatsApp messages of him sweating buckets in the tent outside. I wouldn't want to be there. And you then start to have a real idea of how you're going, or what you're going to do and how you're going to go about it. I wanted to touch on the local thinking versus global thinking quickly. Because again, I think this is one of these topics that as clinicians, we argue about when actually we're talking about the same thing. I love local thinking. I've got people that do a much better job at treating it than I do. I've got sports therapists, massage therapists, and physiotherapists who do that fantastically. But that doesn't stop a patient coming into my office, and that doesn't stop people thinking that a chiropractor will deal with that. Thank you. Okay, 10 minutes here as well. You wanted to do that discreetly, it didn't work. Now, when we respect the fact that there can be local issues, we also have to start thinking about trauma, the aspect of self-healing that was touched on. Very important. I have no issue with the concepts of self-healing. I think it is a universal tenet across all of healthcare. Like was mentioned before, you know, I've got all sorts of healthcare providers in my family, and they all subscribe to that. Because that's what they see, whether they stitch them up, whether they give them medication, it's all about the body using that in order to improve a situation. We just do it one step further out. Third thing was that you need to understand your tools to deal with local suffering, local trauma. We have lots of tools. We have shockwave therapy, we have laser therapy, we've got Graston, we've got all these bits and pieces that you can use. I don't. As a chiropractor, I'm adjusting, but as a case manager, I'm managing. And then we get into why Jaco doesn't know the word subluxation. Because I talk about it as removing interference on your body's ability to heal itself. That's all my patients need to know. Because if I introduce a heel raise, or I introduce some kind of supplement, or I introduce some kind of therapy, that's what they are geared to do. And as long as we can do it in a predictable way, then we have treatment, which I know, again, is a controversial word. Global thinking, on the other hand, is that, I need to wear my glasses, that of considering the body's behavioral output as a singular outcome of a series of calculations made to produce and achieve the most cost-effective balance between your proprioceptive input, what you know is the now. Your brain needs to know what you're doing in the now in order to then calculate on the back of what it has experienced in the past as to determine what it's going to be doing into the future. Now, some of you might recognize some of this is the Bayesian brain modeling. If you don't know about it, have a look at it. But basically, it's all about now, past, now, and future, and looking at how we anticipate behaviors. When I'm looking at helping Jaco, and I'm looking at really understanding what helping means, I need to understand what that means to him. Jaco is not bothered about comfort. If I could get 10% more power out of his legs, but he would be twice as uncomfortable, he'd take it. Because it's all about performance. So we had to obviously go for the global strategy. In terms of clinical presentation, there were lots and lots of data that I can show you and play with. We did lots of measuring, and I mean lots and lots and lots of measuring and testing and dynamic testing, static testing. I was just trying to figure out what on earth was going on and how we're going to deal with it. Out of all of that, I ended up deciding that we're going to do a mixture of local and global thinking. But obviously, as a chiropractor, born in a chiropractic family with lots of healthcare providers, I just wanted to look at adjusting first and foremost. And that's when we started to notice the very first set of changes that Jaco kindly referred to. And it was dramatic. It was like, it was blowing my, I mean, at that point in time, I'd been in practice for 12 years already. So I'd seen a few things. I'd been, watching lots of other people far better than me at doing the chiropractic thing. And yet, going through that and looking at the hard numbers was really quite eye-opening. We had to deal with the scar tissue. That was not very pleasant for you. And there were lots of therapeutic approaches that we looked at, and we just tried to identify how we're going to deal with it. One of the problems that I had was that his scar tissue was causing an imbalance in and inhibition patterns between QLs, glutes, quads. And of course, the problem was that the issues on the left leg, as you will remember from the pictures, and they are quite graphic, but they were causing inhibition on the power leg. We couldn't afford to lose power. We couldn't afford to lose stability in the pelvis. So I had to figure out a way that I was happy with and congruent with in order to make those changes. And that's where this one comes in. I had to compensate for a functional dysfunction. Hate it. Hate it, but I had to, because I couldn't figure it out. I traced, I looked, I tried to figure out, I tested, couldn't find out. So I was only left with one option, and I was to owe up to this guy. So we had a conversation. I explained to him that there was a whole bunch of things that I did know about him, but there was 10 times more that I didn't know. And I had to try and figure out a solution that I wasn't happy with, but it was the best that I could come up with. This is real talk. It's not about making promises, but it is about working within a framework that you can feel comfortable with together in a partnership. So we ended up introducing a heel raise on the left side underneath his orthotic, which is another point of controversy. An orthotic, to me, in his case, is nothing different to a pair of glasses. It doesn't change the physical reality of how that foot behaves, how that knee behaves. It doesn't support the arch. Well, nonsensical word. But it does change how your brain perceives the connection of the foot between your foot and the ground. And thereby change the way that your brain calculates that it will tell your musculature in your leg to respond to that reality. There are a lot of things like this that we do need to open up to. And from conversations, I'm seeing a lot of people, going in that way. The fourth big issue was strengthening. So in strengthening, there are a couple of real problems when you have a limb missing. And so we figured out a few new novel ideas, new ways of creating strength behind or inside muscle groups that we couldn't access. So one of the things that was really, really powerful, I think that's the next slide, yes, there we go, was this thing. So what you're seeing here is an EMS machine, we call it Physiotech, creating contractions within muscle groups. And as you can see, the contraction, it's not like a slender tone where you actually have to stick it on, for those that don't know this kind of equipment. But we were able to do this, and that's what I wanted to show you. That was a very important moment when we were able to start strengthening the musculature behind the shoulder blade. And in doing that, we managed to actually increase the amount of pull that Jaco could produce through his prosthetic onto the steering column into the starting position, because Jaco sadly has to start from a seated position because of his prosthetic forcing him down into the saddle. So as you might see later if we have time to show it, his weakest point is actually the first starting lap. If Jaco had to race in a one-lap race, he'd be buggered. So it's after that that the power comes in, and that's when it starts to really pick up. So we had to find ways, and this was one of the things that we found in order to achieve that. We also used a bike fit center that is on next to our clinic, like literally physically next to our clinic, people at Velo Atelier, and they started working on things like riding posture. But again, none of it was really about comfort. It was about aerodynamics, it was about power output, it was about speed. So any position, if it was worse comfort-wise, but better on drag, he would have taken it. Yeah. So we had a lot of outcomes to deal with here. Power, speed, comfort was one. Power was the big one. Speed, obviously. And this then was the daddy that comes out of that. Your wins. Now, like I said, when we're looking at comfort with our normal day-to-day patients, that is a big thing, right, on their outcome list. That's what they want. They want to be less disabled, more enabled, less painful, less inconvenienced. And obviously, I want that for them too. But the reality is that there's always a bit of give. Now, as luck might have it, we actually got all 4 of those in Jaco's case. I'm going to take full credit for that. Now, we also had other things to consider. I know I'm running, thank you. We were also lucky enough to have lots of other companies involved. This was really a team effort across multiple teams. This is one of the things I just wanted to quickly show you. This is Batman's wing. So this was an alternative prosthetic that was built specially for Jaco. And it reduced drag by 6%, which would have translated into an increase in power output of 8 to 12 watts. Now, 8 to 12 watts is like a cyclist's wet dream at that point. At that level, you know, we're talking about wet dreams a lot today. And there's a lot of 3s as well, by the way. Donald must be happy with that because, you know, 3 golds, 3 worlds, you know, all that kind of thing. Actually, my locker at the gym is 33 as well. So, by accident. But this wing was 8 to 12 watts. The work we did together was
30 watts.
30 watts. So where that, something like this would have saved about 0.6 seconds per lap on average, the work we did saved about 2.5 seconds per lap. I can keep going if you want. But that's one of the things that was really, and I'm just going to go through, this is just, again, data showing you differences in riding position. How do I move that on? There we go. How do I move that on to the next slide? There we go. Sorry, do I need to? Okay, so I'm just going to go through quickly ideas. We had to use shims instead of heel raisers. When you're cycling, you're not contacting on your heel. You're contacting on your forefoot, you're clipped in. So we've discovered that shims were a useful alternative, and it elicited the same response. We used the Physiotech machine that I showed you to enable muscle contraction in places that otherwise we couldn't. We figured out a treatment schedule. This was the thing that Jaco was referring to. We were maintaining him in a place that he was happy, able to perform. You know, the pandemic has been an absolute glorious event for me. Everybody realizes why they're paying me every month. It's great. And this is what was one of the effects that I had for Jaco too. He ended up realizing that there was a huge amount behind it. Most of all, I wanted to give you something out of this talk that meant that you understood that none of this is special. I'm not special, Jaco is, I'm not, my team is not, we're just doing our job. We're just doing our job, we're talking to each other, we're challenging one another. I'm pointing over there because I have 2 people out there that are currently working with me, which is fantastic. And I've got one that is my son-in-law, poor bastard. He is now studying in his first year at the ACC. I couldn't be happier. I feel like an old fart now because it feels like I was only there yesterday. And I want you all to understand that that is the place I'm coming from. It's a place of humility. I'm hugely grateful for what chiropractic has done for me, personally, emotionally, financially, practically. It has challenged me in every single possible way. And I hope that it does the same for you. I'm just going to click through this. This is a whole different conversation that I haven't got the time for, so I'm going to move on.
I'm feeling a bit nauseous out there. Oh, that was hard. That last little bit was... That was tough.
Life will test you in every moment. It is how you react that defines you.
One more.
And when you thought that you've had everything thrown at you,
One more.
life will test you once again. And again.
Jaco! Stay with me!
It is how you react that defines you. The ability to push yourself somewhere beyond.
The Jaco van Gass double gold.
You are more powerful than you'll ever know.
And if there ever was a message that you could deliver to chiropractors, I think that's it. Thank you. Right. I'll take it. No, hang on. Stay there. I want this. I ain't bailing out of that. Thank you. Thank you very much.
Oh, wow. Stefaan Vossen and Jaco van Gass, everybody.